I get very it's kind of lame because I get very excited about dentistry. And it's primarily because there's so many new things coming along and we can do things better and better and better. And and what I mean by better is more comfortable to patients, longer lasting, better looking, things that just make the dentistry more available to patients. And when I talk about things like that, I might say things like a cone beam, which is a three-dimensional type of X-ray. It's just night and day, the difference in terms of my ability to diagnose problems when I have access to that kind of a device. As a result, I was certainly one of the few people in the province, first few people in the province to get one, because they're not inexpensive. But I am so happy I got that, and it's the same thing about things like microscope. I know that when I had mine, I was the only GP in the province who had one, and people would say, "Well, why would you do that when other people aren't?" And I've never thought that way. It's like I don't need to know why you're not doing something. I just need to know what this is. How could I use this? How could I play with this? Would it help my skills and ability? And that's how I make my decisions. Is I just really try to source things that can make my life more interesting and better. And I tell you, there's always stuff up there, and that's the more difficult thing, is slowing myself down from jumping into buying a new piece of equipment and this, because of course sometimes you get burned and you just spent $70,000 on something that's really going to be garbage. That happens, but most of the time it's worked out really well. And when I say well, it's for me, but really my patients are the end receivers of this. And when I can see things and solve things so much better than I could do in the past, or could do without, say, some of the technology, honestly, you feel pretty good. I also, find that I hate to give up on anything. I just never really like to say, don't know, can't fix it, because somebody will know, and depending on how important that is, it's a matter of spending the patience and time really listening to the patient, and then listening to colleagues. Sometimes there's nothing you can do, but most often there's something you can. And that were, for example, that eventually led me to some of the things with the low-level lasers and photobiomodulation, because things that we could just not do anything about, such as dry mouth, people who have no saliva. Well, other than one drug called Salogen that, as I understand, is quite expensive and is so in effectiveness, there's nothing. Can't do anything for you. I'm sorry. Well, I don't like that, and I found this other technology, which is really a well-researched thing, and it does. I've restored saliva on many patients now, and that's what I mean. Is it's so exciting. You just don't know what's around the corner, or even that it already exists. That's just not being utilized right. So it's a continuous sort of adventure. I'll catch myself thinking, well, I'm this age, which I won't say right now, and so I really should be thinking of retirement. But then I say, yeah, but do you like what you're doing? And I do. I mean, I really enjoy it. I don't always enjoy 7 o'clock in the morning, I have to admit. And maybe having some shorter days, but because I'm really inherently lazy. But I do really like coming to work, so I could be doing this for a very long time, and especially because I know there's going to be new cool things coming down around the corner, and that's going to always pull me back.